Long time coming, Dr. John. Here we are announcing our Perfect Storm Summit. And I got to say, this was an idea that started with a twinkle in our eyes, right? I mean, it basically started with, hey, why don't we get a lot of the people that we've talked to give us their insights on the perfect storm? And here we are. So why don't we do this? Why don't we just announce who's speaking for our summit? We'll just give a quick little tidbit on what their talk is called and
Okay.
how the listener can go about getting more information and securing their ticket to attend the free event, but also get some of the VIP tickets that we've put to or items that we've put together. So yeah, why don't we, or you can even just give me an intro on your sparkle in your eye and how
Yeah.
this came about too, you know?
Yeah. So like I said, a lot of work, and I guess, we wanted to kind of bring this to allow other people listening to listen to other people besides just us. And, there's a lot of great healthcare experts out there that kind of work in this genetic and detoxification or epigenetic kind of world, that have a lot of information. And it's great when we kind of put our heads together and collaborate, and learn off of each other, and then be able to bring that to anyone that wants that information, especially those that still struggle with any type of, health challenges. And so we put together this free 3-day summit called the Perfect Storm. And the reason we called the Perfect Storm is it's really focused on how epigenetic factors or genetic predisposition combines with those epigenetic factors that creates that perfect storm that leads to chronic health issues, and really gives a lot of insight into a lot of the rabbit holes or a lot of the rocks that need to be looked under, that maybe aren't. And we have a really, really amazing lineup of experts with their own niches that are really going to kind of bring a different topic and a different concept and different focus with each session. And just, it's been a lot of work, but the reward has been amazing. I just know for myself, just, interviewing all these experts, all the things that I learned and picked up and things that I've, kind of put on my hit list to investigate or change up with what I do with my patients and clients. It's been life-changing already. Just went through the interview process with all these speakers with the last couple of months. But here we are. And we're ready to roll with this. And we're about less than 3 weeks out when this is going to air starting June 5th. And like you mentioned, it is a free summit, but people can join our VIP access pass. And with that, they can get lifetime access to all of the video and audio replays of all these amazing speakers and amazing topics that were presented, along with about, I think it's over $1,000 worth of bonuses that the speakers have given us to give you as a thank you for becoming a VIP member. And so we kind of been saying it's kind of a win-win for everybody in terms of, the content that you're going to get that's life-changing, plus of all these free bonuses that you're getting, from these speakers. It's going to give you a lot more insight and a lot more tools and resources to really take your health to the next level and really optimize it. So, I'm so excited for this, that is ready to go. And we want to tell everyone about it and really encourage you to, click the link below here and go register. And get your free ticket now, so you're locked in to be able to watch this over the weekend. And even better yet, go and upgrade to that VIP pass. And it's something that's going to really give you a lot of insight and going to be something you're definitely going to want to hold on to be able to go back and listen to some things, whenever you need to. But we let's talk about the speakers we had, that we interviewed. Amazing, we got Dr. Ben Lynch to come on board and talk about, should you or should you not access your genetic data? Do you want this information, and what does it mean from a big picture standpoint? So, Ben brought a lot of insights and takeaways that's really going to, big picture kind of give you the relevance of what this genetic information means, and really kind of how to use it as a tool or a resource to investigate any health challenges you have. Dr. Nathan Bryan, talked about nitric oxide, and really kind of give us a journey of what nitric oxide is, what nitric oxide does to the body, what are some of the, health challenges somebody might see due to nitric oxide depletion, and more importantly, what are some of the things you can do to restore that? And so you're kind of really being enlightened on how much nitric oxide can be a huge, huge missing piece any of the health challenges that you're suffering with, no matter what your diagnosis or condition is. What were some of the speakers that you really enjoyed?
Yeah, I mean, I'm just going to backtrack on one of the bonuses that I'm really most proud of, John, is the time you and I took to really give our insights on the main takeaways.
Yeah.
One of the common questions that we asked all our speakers is, as a society, what can we do, together to mitigate the perfect storm and to maximize our health? And you and I really kind of give the cheat sheets, takeaway points. And like you said, one of the things we really want to make sure of with this seminar is it's not just a lot of complex information. It's really sound bites, bite-sized pieces of information that you can walk away with and implement right away, between looking at specific genes or protocols or mindsets or supplements, or just usable information. And we're creating those cheat sheets so that if you go for the VIP, it's just a matter of, once you get into that membership site, you download those cheat sheets and it pretty much summarizes the entire talk for you.
Yeah.
But anyway, yeah, I would say, the next speaker, Mike Mutzel, in terms of the autophagy and how environmental triggers can impact the ability to get into autophagy. So many people are about intermittent fasting and keto diets, and not that we talked a lot about keto diets, but we did talk about more of the ancestral approach to cleansing and regenerating. And if you look at society in today's day and age, you take a picture of the 80s and the 70s, compare that to the 2000s and the 2010s, people are bigger, more chronically ill, and that's because I think we have so much environmental triggers that are causing more imbalances with autophagy and mTOR, and that becomes major problematic. So I think that was a great talk as well. I know you really enjoyed when we talked to who was it? I'm just thinking of Dr. Lori Miller, because that was
Dr. Stevens. Yeah.
Yeah. I'm sorry, Lucky. Yeah. Sorry, Dr. Lori. Sorry. Yeah.
Lori Miller Stevens. So yeah, she's a personal friend of mine, and she. It was great to get her to come on board and spend some time with us, because she is a biological and holistic dentist. She's the former president of the HDA. She's going to be the next president of the IMMT. And she really talked about the dental perspective, and kind of just beyond maybe the things you've heard of before from the dental perspective, that just deals with kind of, hey, mercury's bad, get it out. She touched on that just briefly, but she really got into a lot of the biomechanics that deal with like breathing and how that affects crowding of the teeth and decay and changes the pH of the body and changes the chemistry. And it kind of goes back to one of those foundational things of, breathing, and a lot of people don't know how to breathe. And so she really talked about how that impacts our biochemistry, specifically from a dental perspective. So it was a great chat. And like I said, I've been a friend with Lori for years, and getting her to do this was, pretty easy. I had to twist her arm just a little bit to do it, but she had some amazing information. She was just another great speaker that we had on board here. We also had, Dr. Kelly Halderman, talking about weight loss and Detox 2.5, which is kind of like a something that she's kind of coined and really kind of researching. And then to tie into that, we had Dr. Eric Baklavash, who was talking about cellular hypothyroidism, and the stresses we see there. And having those two speakers was great, because they're just coming out with a book called The Thyroid Debacle, which talks about thyroid components and how this plays into it. So, to be able to pick their brains individually on all their research that they put together for their book, and now kind of bring kind of the Cliff Notes version, to everyone that's listening to this before that book hits market here in the next month or so, was amazing, and a lot of great points. And so if you have thyroid issues or you struggle with weight, those are two speakers you definitely want to tune in to and listen to the things they talked about, as well as some of the things that is kind of newer cutting edge stuff based on the research they've been doing for their book. And so some amazing stuff. So who else, did you really like that we interviewed?
I can't forget Kerry Jones. Kerry Jones, everyone knows Kerry. She is awesome. I mean, she works for probably the best hormone test out there in the Dutch test. that people are familiar with, as I work with clients that are exhausted and burnt out and identify themselves as having an adrenal problem. Kerry brought it, in this presentation. We talked about environmental triggers with estrogens and hormone replacements. And the great news is that when Kerry talks to some of the people she works with, women that have challenges with estrogen and they're taking hormone replacements and they're really scared about estrogen-like cancers, she really gives usable information based on those test results on what you can actually do to reduce those toxic burdens, which is researched, right? In terms of phase 1, if you have major genetic polymorphisms or not, and you may have exposures to some of the chemicals in the products you're using, or you drink alcohol, those are known to slow those down. And if you see those being or to accelerate certain pathways and slow down other pathways. So if you're going down the wrong pathway and you are concerned about cancer-based problems, and you see that basically on a test, she can digitally pinpoint wise be able to give you the recommendations. And I think really that was our goal, to be able to interview these guests and be able to give us these walk-away pieces of the puzzle. And then, of course, probably your and my favorite talk would have been with Bob Miller, and connecting the dots with Lyme disease and mast cells, iron imbalance. I know when I talked to you before we even prepared the summit, and you were asking me like, so, have you seen the changes with iron? And I'm like, no, like, what are you talking about? Then you got into like, okay, well, pretty much everyone has an iron problem until proven otherwise. Bob got into that, but maybe you can just give us a little teaser on why that's so important with chronic illness.
Yeah, so it goes back to inflammation, and the thing is a lot of people are going to their doctor and getting blood work and, looking at like one piece of it and told they're anemic, and then being, told to take iron, and that could be lateral flow in the fire. And a lot of it comes down to like, where's iron getting stuck? And if iron's getting stuck and not transporting properly, it's lateral flow in a fire, and it can really drive a lot of inflammation. And especially if somebody has other variables like, histamine intolerances or infections like Epstein-Barr or Lyme disease, which Bob talks about, and especially some of the research, iron is one of those aspects that's really got to be in a delicate balance. And when it gets out of that delicate balance, it could be something that could be really raging that drives a lot of chronic health challenges. And so, Bob kind of talks, about some of the genetic components and some of the new research and kind of how iron and Fenton reactions plays into people with some of these epigenetic stressors. And so, Bob's great. He's very technical, but he kind of really summarizes it up for everybody to understand. He's kind of, along with Ben, kind of one of the pioneers on the genetic aspect from a research standpoint. So, like I said, to have him be a part of this was, we are very fortunate to get him to agree and be a part of it, because I know he's really busy with a lot of the research that he's doing and things of that nature.
Yeah, no, absolutely. And then, of course, Dr. Christine Schaffner, she works alongside Dr. Klinghardt, has her own podcast. Very big privilege to have her part of our summit. What was amazing about her was getting into the energetics and the holistic approaches to heavy metals, pesticides, EMFs. And I think that was one of those key ingredients that we have a ubiquitous, or just it's always there around us that we're not aware of. And she put it into 3 buckets. She basically talked about the heavy metal bucket, talked about the pesticide bucket, and talked about the EMF bucket, and really gave us insights as to how those will interfere with whether or not you have genetic predispositions or not, but how they will really interfere if you do have genetic predispositions, what genetic predispositions to look for, so that people, like, again, John, I think it's important to say how we evolved from MTHFR crash course, right, to the Perfect Storm Summit.
Yeah.
And a lot of people were going down that rabbit hole of MTHFR. But then they realized that if you take methylfolate, it's the be all end all. And I think their doctors don't know a lot about it. They know more than their doctors do. And then they're doing all this research on their own, only to find out, oh my gosh, how much is there to know?
Yeah.
So I think with Christine's talk, she really got into the concepts of why the highways get dirty in the first place, or why the genes get dirty, or why the traffic on the highway is more problematic than potentially the gene SNPs alone. And I thought that was a great talk as well.
Yeah. Yeah, she had a lot of great points, and I like Dr. Christine, taking the time to do that. Especially, you mentioned, she works side by side with Dr. Klinghardt. A lot of people that tapped into some of these epigenetic stressors may know of him, and really kind of follow some of his things. And so to have her, present on things like EMFs and heavy metals and pesticides, she's in the trenches seeing patients, but also working with, one of the leading experts in detoxification from that standpoint. So, her insight into that, as well as clinically what some of the things that they do in their facilities, was really, really great. And then, to kind of take that to the next level, we were talking about some of these stressors, these epigenetic stressors, we were able to, interview Dr. Elena Villanueva, and really kind of take that concept of some of these stressors and how it applies to brain, and that mental picture in terms of people that suffer with emotional things like depression and anxiety and anything neurologically, and really talked about kind of that big picture of how mental health and some of these genetic and epigenetic stressors create that perfect storm from a mental health standpoint, and really gets into, that you got to look for the roots, and it's what, a lot of the, the presenters kind of, stressed and what this Perfect Storm Summit is about. But that was a great, session with Dr. Elena. And especially, there's a lot of people out there that have challenges of depression and anxiety, OCD tendencies, kids on the spectrum, anything, that some of those, brain-based, health concerns, and her session, we kind of really focused on kind of the brain aspect with it. And so there was a lot of great, take home points from, from what we talked about with her. And then we actually, we're fortunate to get a buddy of yours, Robbie, so why don't you tell me about, about Robbie and kind of like what people are going to learn from his session?
Yeah, I call Robbie the Wizard of Oz. He has his hand in all the detox, ionizing, full spectrum, infrared, how to get these toxins out of our body. And it was a great talk in terms of reminding us that it's a daily battle. It's a second to second battle, and we have to be very vigilant with getting these toxins out of our body. And the just frequencies of light, just getting the full spectrum of light outside is really important. Sweating is really important. But he really went into the mechanics of infrared, shared his personal health story, and we both agreed he's really heart driven and is really a pioneer in bringing infrared technology to the US. And we talk about some of the concerns that people have with infrared. Well, I hear you get EMF exposures, and he really puts that down in terms of how he's created an ability to not allow the field of EMF to collapse the infrared field. So he basically harmonizes the field. And then we also got into the concern with, if you're in wood that's been treated, or plastics, or a tent that has sprays on it, you may be getting worse offending toxin exposure while you're looking to remove your toxins. And that was an awesome part of the talk as well. And you know what I got to say, John, I really feel, because when I was watching you, it's interesting, when we were watching the speaker speak, and then, I kind of watch your insights, and I kind of see almost invisible light bulbs go off. I was like, oh, I wonder what that light bulb was. I wonder what that was. And we got that, I think, with Susan Owens, where she talked about the journey of discovery into oxalates and immunity and genetics. And you turned me on to oxalates with your research, and you're a huge mentor to me. I know you work with a lot of autistic kids as a big demographic, and that's a huge component of their findings, but also in everyone's findings, where if oxalates aren't on your radar, you need to have them on your radar. So maybe give us a quick little soundbite on that.
Yeah. So, listen to Susan, talk and present her research, and I say research, I don't want to kind of scare people off, but it is kind of research she presented, but she did it in a way that just the general person is going to understand kind of the big picture of how this oxalate story can be a factor in creating stress in your body. And so that the whole time she's talking, like it's a light bulb, light bulb, light bulb. And it's something that I look at oxalates with pretty much everybody, because it is one of those things that if it is there, it's going to create a lot of roadblocks for anything else you're doing to be as effective. And so it was great to listen to her on kind of the connection, how there's genetic factors that are pieces of this, how there's other stressors that are pieces of this. And she really gave a lot of also some take-home points and kind of how to do it and understand that, there is a method to the madness to kind of decrease the oxalate burden, and you can't simply just jump in and do it too fast, because, it can create a lot of stress. I think there's a lot of great concepts from her talk. I was taking notes the whole time, just things that, I forgot, or some new points I learned, just talking about, kind of back to the iron story we talked about with Bob, right? Just talking about how, or Susan talked about how, if you have increased oxalates, it's going to act as a chelator. It's going to chelate essential elements like iron and magnesium and things of that nature. So, if you're magnesium deficient or you're iron deficient, you've got to consider oxalates as a piece of this, and so that's, some really, really amazing take-home points from her. Like literally, I kind of joked. I said, she talked for about an hour. I'm like, I could have asked questions for 3 hours just because I had so much information. I wanted to pick her brain because, she is a researcher and that's what she does. And she's got some pretty amazing, social groups where people can, have those resources to join those to learn more about oxalates and answer questions if this is an issue with you. But you're going to get a great introduction. And if oxalates are something that and it's been a challenge, you're going to be able to really understand kind of big picture what that means, and probably pick up some additional information in terms of things that you maybe need to do a little different, a little bit better in regards to controlling that oxalate burden. So yeah, when Susan agreed to join this talk, and she was one of the last speakers that we actually, were able to, keep asking and get her on board, it was like, yes, because I know that was something that really ties in to the perfect storm aspect. And it is a big piece, because when we talk about all these stressors like heavy metals and chemicals and things of that nature, a lot of times oxalates are an underlying stressor as well that is not looked at nearly enough. So that was an amazing session. And then another person that we kind of got in last minute to agree to do this, and I know it's something that you were working hard to get Dr. Grace in. So why don't you talk about a little bit about kind of Dr. Grace and what she's all about?
Sure, Dr. Grace Liu, the Gut Institute, Bugs Over Drugs, and it's interesting because she is a pharmacist turned holistic provider. And I think the real take home, which we talked about earlier for me, was the analogy that she used of your gut is really a pharmacopoeia. And if you're giving it good ingredients, it's going to take care of your body. And 100 trillion ally cells that we can use to help us, and how we can really get those keystone biomarkers in place, and that will lay the foundation. But if you don't have those keystone biomarkers in place, you will have major health challenges. And we all know it starts in the gut. We know 80% of the immune system's in the GI tract. But I think what was really good about having you and I give her questions is, I can go down a rabbit hole with her, or you can go down a rabbit hole with Susan, and then we bring the other person back online. And that's what you did with her. Well, hey, we'd really like to talk about what you're talking about, but let's bring this back into histamine, and let's talk about histamine and genetics. And you did a great job, because I don't think most people understand the idea of what histamine is. I don't have allergies, I don't get itchy nose or runny nose or itchiness or turn red, so why do I got to worry about it? Maybe give the listener why histamine has to be on your radar as well.
Yeah, we could, do many, many hours on histamine aspects, but we know that, there's histamine receptors all over the body, and there are specific histamine receptors that revolve around that kind of sinus and allergy aspect that deals with kind of pollen seasons and different environmental components. But we know that, histamine can affect reproductive tissues, histamine can affect the brain, histamine can affect the guts. And she really went into it and talking about, things that maybe people are kind of getting on their radar, like, DAO deficiencies and low histamine diet component. But she kind of really went into even some of the things dealing with, some of the bacterial components and some of the infection components. I know how that can proliferate histamine levels in the gut, and then she really kind of went into, some of the strategies that they look at, in terms of prioritizing, how to address, this whole imbalance in gut function that really is a piece of it for pretty much everybody that has health challenges. And everybody's really working hard on trying to fix their gut because they know a lot of their symptoms, there's a gut connection, but it seems like they're always trying to fix their gut. And so, Grace, brought in a little bit different insight into some of the things that deal with the microbiome and specifically how histamine relates to that. And then also talked about some of her strategies in terms of what they do in their clinic, as what they do in terms of teaching physicians, because that's something she does as well. She teaches doctors her protocols to be able to help those doctors' patients be able to restore their microbiome and regain their health back. So, Dr. Grace, amazing. She was a lot of fun. We learned a lot. I know that talk itself, there was some concepts that I know that, I wrote down and starred because those are things that kind of are on my radar, some newer things that, I really never heard of it and really wanted to kind of look at a little bit deeper. And so it was an amazing session with Dr. Grace.
Yeah, and then of course, not to be forgotten is the mentor to both of us, Dr. Mike Johnson.
Yeah.
Really always a great guy to talk to. He shoots from the heart, and he talks to you like you've known him forever. We talked to him about regenerative medicine, and we originally just had anticipated to talk about stem cells, which in and of itself would have been an awesome topic. But it's like, well, you really should be talking about the idea of peptides and how peptides and what they are and why they could be so supportive. And I think the thing that you brought up to me and to us out loud is, hey, we got to ask them. Let's make sure we ask them, like, why is it when you have someone that goes to a regenerative clinic, it's not the be all end all. It's not just going to be a magic wand and wave it and you're just going to get improvements. You have a lot of due diligence, if you will, to do prior to getting in, the results you need. And sometimes when they do the due diligence, so to speak, they don't even need to do the peptides or the regenerative stuff. So maybe get into a little bit of sort of how the diligence is right on line with the concept of the perfect storm.
Yeah. So, with what, Mike talked about in terms of, stem cells, and then now he's, starting to do peptides because he feels and was seen as peptide therapy is actually probably more beneficial, or productive than even the stem cell component. But then he talked about you have these foundations, right? You got to address this perfect storm because somebody can go in there and their lifestyle can be garbage. Genetically, they could be a mess and you're not doing things to optimize your genetic expression. And then on top of it, maybe they have all these stressors, like they're loaded with metals or infections and things of that nature, which all this kind of goes back to inflammation. And you kind of ask Mike and saying, hey, what are you seeing on why people that maybe do stem cells or peptides and don't get any benefit? And they're spending all this money for this kind of miracle, procedure that's supposed to, cure their autoimmune issue or fix their knee or shoulder or whatever they're doing the stem cells for. And some people get miraculous benefits out of it, but the majority, there's downfalls. And so he talked about, it's like, you got to address the foundations. You got to address the perfect storm first. And if somebody is a mess and has that perfect storm going on, they're going to be inflamed. And that inflammation is not going to allow those stem cells or those peptides to proliferate to promote a healing environment. And so he said in his clinic, somebody's got to go through those things first, and if they don't, those things are there, they strongly discourage somebody from doing those therapies because there's going to be limitations. And so it really kind of brought home another perspective because there's a lot of people that are seeking and looking for doing those therapies, but they have to understand there's a little bit of work they got to do first so that those therapies can be as beneficial as possible. So getting Mike to talk about that aspect, because the regenerative medicine and stem cells, it's kind of so buzzworthy right now. There's all these clinics popping up and, people are going to pay $5,000 to $10,000 for an injection here or there. And it's like nothing, well, why is that? It's because of inflammation. Now, if they address the inflammation, they go back and do that again, they may have a completely different outcome the second time around that's really going to improve the quality of their life.
Yeah, absolutely. And then of course there's us, right?
Yeah.
So I'll just, to us. So, John, you really are a mentor to me, and how you embrace this information, and your passion, or I won't say passion, but your area now of interest based on where you live and what you see and how ubiquitous it is the role of mycotoxins. And I don't think any perfect storm summit, which looks at the genetic component and the environmental triggers, would be complete if we didn't talk about mycotoxins. And you've done some research into it. And really, I know it comes down to now, like, people don't know what mycotoxins are. We're talking about mold exposures. And it doesn't just have to be in a damp, hot area place. Wherever water sits can have mold, and even in food. And food is bulked, and it gets contaminated. And it's pretty much, I know, as what you say now, is it's guilty until proven innocent, right?
Right.
It's because it is such a big impactor of the whole mast cell activation, the histamine issues, the depletion of your raw materials, impacting your excitability, and then create a vicious cycle of starting that cycle all over again. And you gave some great information on there. Any quick little clinical pearls you want to share with people that are going to sign up for this that you talked about?
Yeah, I just kind of big picture with that. I just think that the mold aspect has to be on people's radar, no matter where they live, because, here in Georgia, it's one of those things where, you start running mycotoxin tests on more and more patients who have health challenges that maybe have done everything else, and you're seeing that as a factor. And then you kind of get into their history, and it's like, well, I lived in a place that we had to move out of, 4 years ago, and it's like, how come nobody's ever connected the dots on that, or, yeah, we had some water damage in our home and we had it remediated, and that was, or, we had it, kind of cleaned up, the drywall cleaned out. But the thing is there was other steps that weren't taken. And now that mold that's dried up and flaked off is circulated in the air ducts, it's in the clothing, the carpet, and it just is recirculating. And through the research we kind of did for our Your Genetic Type concept, we kind of, found out that there are specific genes that correlate to, a specific genetic type. But also, one of the biggest stressors that affect that genetic type is mold, because there's a lot of medical research on key genetic factors that deal with antioxidant and inflammation control that mold can really disrupt and create that perfect storm. So, mold, like you mentioned, mold's got to be on the radar for anybody with any type of chronic health challenges looking for answers, because it can be a lot of times a missing piece. And then lastly, I was able to interview you, on your forte, this kind of adrenal fatigue aspect, and how that plays into the perfect storm, and really how, the kind of our stress response is impacted by that perfect storm, and how it affects things like our HPA axis and things of that nature. So why don't you kind of just tell me a little bit of a, one line kind of, tidbit from that people are going to gain from your talk?
Yeah, I mean, I like to talk about the truth about adrenal fatigue. I kind of use it as a cloak, like a bait and switch. Like, oh, this doc's talking about adrenal fatigue, he must not know what he's talking about. I was like, well, let me show you I do know what I'm talking about, because at the end of the day, it goes so much deeper than the adrenals. And the research that I've been doing is that same instance. You could have a mold problem that impacts your mast cells, but then when you go on to see what the mast cells do and what they shut down or what they inhibit or what they encourage is the HPA axis. And a lot of people will say that the adrenals are an HPA axis dysfunction, but that's not to say that mast cell activation is a dysfunction. It's a normal action of the body that needs to happen in response to maybe something that is inappropriate, like a mold. So basically what I wanted to do was I wanted to raise the antennas of people that are exhausted and burnt out, and really get them to understand that it's the physiology that is starting to break down, and not just the adrenals, and give them ideas on what they can do to really address getting better in terms of how they perceive stress, how they can stabilize their blood glucose and look at those numbers, really replenish their nutrients and get their body levels higher. And then also make sure that they're getting rid of the things that are causing those alarm bells to sound. So all in all, look, we just talked about 16 amazing presentations. It's totally free. We want you to take advantage. You sign up right away, get your pass so that you're dialed in, so to speak. But consider getting the VIP pass, because I know when we talked not wanting to have this be a 7-day summit, right? We didn't want to have this going the whole week long, but we also wanted to get really captivating speakers, and it's 3 days. And that's a lot of information to have to take in 3 days. And we'll keep it open for 48 hours afterwards, so you can watch that too. But the thing that I really like about the bonus, the VIP, is we've decided to open up the ability to watch them the Monday before. So you got plenty of time to watch that earlier. You get the cheat sheets, you get all of the lifetime access. There's no delay on when you have to watch them. What else am I missing in terms of that VIP? I know you had mentioned it as well.
You mentioned the kind of our summary takeaway component, but then all the free bonuses that our speakers have made available. There's a lot of links, a lot of downloads, recipes, dietary lists, a brain hygiene guide. You're giving your adrenal, fatigue recovery kit. There's a lot of free bonuses valued over $1,000 that when you become a VIP member that you get as a thank you from us and from the speakers for becoming a VIP member. And so I think, having the access to these talks, to be able to listen to them over and over in itself is going to be life-changing. But then you get a lot of these other bonuses, which is going to give you some tools and some resources to fall back on that's going to give you additional information to really improve the quality of your life. And so, we really encourage everybody to grab their free ticket, as well as, consider upgrading to the VIP pass, because, it's something that is airing here in a couple of weeks, starting June 5th. And then once it airs, for free, then it's done, it's closed. So we really want you to, join us and take a part of it. And, we'll see you there.
All right. And again, like you said, the only thing to add is, 16 speakers, over 18 hours, right? Great quality information that is, these are speakers that are best-selling authors and great stuff. So go ahead and click on the link wherever you're watching this and get your ticket, and then consider upgrading to the VIP.